Hi guys, I hope you're well and welcome back to Fit Education's virtual classroom. Today's micro teach session is going to be covering postural alignment. What is postural alignment? How do we identify it? And what is the importance of it? As ever, if you find value in our videos, we'd appreciate if you could like, comment and share and help us spread the word of what we do. So let's have a look at some postural alignment. Optimum postural alignment. The spine, along with the musculature of the core, plays a vital role in optimal postural alignment, as the spine, or vertebral column, provides stability during movement. The spine is formed from 33 irregular bones known as vertebrae, and form an S shape from 4 natural curves. 2 of these curves are concaved, including the cervical and lumbar vertebrae, and 2 of the curves are convexed, including the thoracic and sacral vertebrae. Each region of the spine has a different number of vertebrae and are all shaped slightly differently. This allows for different ranges of motion being possible at the various different sections of the spine. The different segments and movement possibilities in each section include the cervical spine, which has 7 vertebrae and allows for large movements such as neck flexion and extension, lateral flexion and extension, and rotation. The cervical spine has the greatest amount of lateral flexion and rotation of any region of the spine. The thoracic spine, which has 12 vertebrae, this allows for the same movement as the cervical vertebrae, including flexion, extension, lateral flexion and lateral extension and rotation, but in smaller ranges as it's needed to be more stable to support the rib cage. The lumbar spine has 5 vertebrae and allows for the same movement of the cervical and thoracic vertebrae, but they are very limited to flexion and extension, lateral flexion and extension, and rotation. The lumbar vertebral discs are the largest discs in the spine, as they are needed to absorb most of the shock from movement and the weight of the upper body. Finally, the sacrum has 5 vertebrae and coccyx 4 vertebrae. However, they are all fused together in the separate sections, not allowing any movement to occur. The term neutral spine describes a natural S-shaped spinal position that is formed when each of the spinal vertebrae is loaded one on top of the other, without any uneven deformation of the intervertebral discs. When the spine is in the optimum position, the stress on the passive structures such as the vertebrae and ligaments is minimal, and the risk of strain or injury to the lower back is minimised. That is why neutral alignment is the ideal position to maintain during both daily activities and all forms of exercise. When assessing from the anterior-posterior viewpoint, you are looking for lateral deviations by identifying the following landmarks: even horizontal shoulders, even horizontal hips, proximal leg vertically parallel, and distal leg vertically parallel. When assessing from the lateral viewpoint, you are looking for anterior-posterior deviations by imagining a line going through the middle of the following landmarks: the earlobe, the centre of the shoulder, the centre of the hips, slightly anterior to the knee, and slightly anterior to the ankle. We hope that you enjoyed today's content. If you have any questions on what was covered, please leave us a comment below. Or if you'd like to support us in what we do, if you could give us a like, a comment, or share, we'd appreciate your support.